Thank you so much, Dr. Ankit Bhargav. Now I would like to welcome Ms.Kim Vopni. She is a well-known author, speaker, and pelvic health coach. She is serving as the president of Pelvin's Wellness Inc. in Canada. So, welcome, ma'am.
And we are going to get started here. I'm going to be turning my camera off. You can see me down in the bottom corner here, and we'll focus on the slides, but I'll just keep it on for a quick second here to introduce myself. For those of you that don't know me, my name is Kim Vopni, and I'm known as the Vagina Coach. And I got into this line of work, I'll tell you about in a few slides in a second, through really my own fear fascination with pregnancy and birth. And I'm excited to share with you tonight some of my tips for showing your bladder who's boss. So I'm going to share 6 of those with you. So I'm going to go ahead and start the presentation. I'm going to turn my camera off so you can focus on the content and not worry about me. And feel free again to use the chat function as we go along. So I am the creator of the Prepare to Push program. That was what initially I started to do when I first started my business, and I was working primarily with pregnant people. And that progressed to starting a second business called Bellies Inc., where I was working with 2 other women to improve postpartum recoveries with the use of a postpartum wrap called the AB system. And that company has now been sold. And I work primarily now one-on-one with individuals through pregnancy, parenthood, and menopause. I'm also the creator of the Kegel Mojo program and the BuffMuff challenge. And I am really honored that you chose to come and listen to me for the next 40 minutes to an hour. Thank you for joining me, for prioritizing your pelvic health. I think that our pelvic floor deserves a lot more attention and PR than it gets. And just by signing up, you made a choice, and showing up, you made another choice. And this shows me that you're ready for change and you're ready to take action. So I love that. In our training today, I'm going to tell you 6 essential steps that will get you thinking inside the box, and steps you need to take in order to eliminate your incontinence for good so you can take back control and show your bladder who's boss. Because let's face it, leaking is messing with your mojo. Spending your days wondering if people can tell, wondering if people know that if anybody can smell, if your pad is still protecting you, maybe you're worried if your partner finds you sexy. This is all exhausting, and it's getting in the way of you living your best life. The good news is you have a choice. You don't need to accept your incontinence as something that you need to live with. You can choose to take the steps needed to address and eliminate your incontinence symptoms, or you can choose to carry on as you are. You have the choice. I'm going to assume that you're ready to make a change, and you made the choice to join this webinar, which is the first step in taking back control and taking back your life. And we then have another choice to put those steps into action. So I got into this, again, growing up, I had this kind of fear fascination with birth. And I saw a video in 6th grade sex ed that made me say I'm never going to be having children. So this is me with my young cousin. I believe I'm probably about 13 years old here. And so I grew up like, nope, I'm never having children. I'm never having children. But I looked at my mom a little differently, and I looked at my aunts a little differently. I said, well, they did it, and they're okay, and they're carrying on. So I was asking my mom questions about her births and her body, and I know that she struggled with chronic back pain. She had a tummy that wouldn't flatten. She got to the point of avoiding exercise because of incontinence and eventually had surgery for it. She had episiotomy births, and I remember learning what that was, and it just sort of confirmed that childbirth was not something that I wanted to go through. So these were all things that I didn't want to do. And that then all changed when I watched my sister-in-law give birth. So she invited us into the room. She was birthed in a hospital. And I remember coming in and looking and saying, oh my gosh, that's a big vagina. And the miracle of it was absolutely transformative. She was in a birthing position I'd never seen before. She was using midwives. She wasn't assisted with anything. It was just a normal physiological birth with no interventions, no episiotomy, and then a return to normal life with no lingering effects. So it was completely different from anything that I had seen in the media, totally different from what media portrays with screaming and yelling and severe pain and people holding their breath and what have you. So everything that I knew about birth was transformed in the situation where I was watching my niece being born. So never say never. It was the following year that I was pregnant, and it was my first child, and that is now about 17 years ago. I was determined to have a different story than my mom. and I wanted to have an experience similar to my sister-in-law. So I asked my midwives about what I could do, and they had recommended a product to me called the Epino. I prepared my body for birth in as many ways as I could, including using the Epino, which is a biofeedback device. And it's that product that actually got me into the line of work I was doing. After I had a positive experience with it, I recognized that not all of my friends did, and that this was such a valuable product and nobody was really talking about it. So I contacted the company, they're out of Germany, and I asked if I could become a distributor. And my intention wasn't for it to become a business. I just wanted to maybe have a little bit of side income and put this product into the hands of other people so they could have positive birth outcomes as well. So I birthed both of my boys through an intact perineum, meaning I didn't have any tearing and I didn't have any episiotomy, and that really was my main goal. I knew that tearing and episiotomies were contributors to long-term pelvic floor challenges, and I believed that by avoiding those, I was going to be in the clear. So on the left, that's my first birth with my son Ty, 16 and a half years ago. And on the right is my son Ben, who turned 14 in January. So it wasn't until about a year after my second son was born that, so that again is Ben on my chest and Ty on the sitting on the little bench, and I was in the clear and I was back to fitness and everything was going well until one day it wasn't, and I was out for a run and I leaked. And I immediately stopped and I walked the rest of the way home, and I kept wondering how the heck this could have happened. I didn't tear, I didn't get an episiotomy, I was fit. I'd been given the green light to return to exercise, and I was well past that 6 month postpartum. So where did I go wrong? Fortunately, I had several pelvic floor physiotherapists referring their clients to me to purchase the Epino. So I had started to receive people recommending their patients to me, and I had never heard of a pelvic floor physiotherapist. So I reached out to them, and it was then that I figured out what I had overlooked. Preventing tearing was my main goal, and I thought that because I had achieved that goal that I wouldn't leak. And what I learned when talking with the physiotherapist was that the pelvic floor is part of our core, and the core is actually a system that is constantly adapting to and managing pressures. Pressures like coughing, sneezing, jumping, also called intra-abdominal pressure. I also learned that pregnancy, birth, and life in general can interfere with that core function, and that the core needs to be retrained before returning to regular fitness. So bingo, that was my missing link. I realized that while I had prevented tearing, I had done nothing to retrain my inner core system. So I realized in that moment that I had very limited understanding of what the core really was. And the pelvic floor is the foundation of the core, and all of the components, so the diaphragm, the transversus abdominis, the pelvic floor, and the multifidus work in synergy. So things like incontinence and prolapse and chronic back pain are signs that that core synergy is off. But the good news is that core synergy can be retrained. So the core four is a team of muscles designed to work synergistically in anticipation of our every move. So we have research on this. And again, it's the diaphragm, the pelvic floor, the transversus, and the multifidus. I had attended a course led by a well-known physiotherapist where I learned all about what that missing link was, what the missing link was for me. And it was like a light bulb moment because I knew it was a missing link for all the women that I had been working with and would work with in the future, even women who have never been pregnant. So this is not something that is isolated to people who have gone through pregnancy or who have birthed a child. So core four function, these muscles contract and co-contract in a certain pattern to ensure alignment, proper breathing, and coordination during a task. So you can think ABC. And the core should anticipate and prepare us for movement. So we know this also from research. It's not something that we have to tell it what to do. It should just do it in anticipation of whatever it is that we are going to do, like lift or cough or jump or run. And the ideal function sees the coordination between that core four, and the timing and synergy of that team is critical for proper support of the spine and the pelvis and for our continence mechanisms for all sorts of stuff. So incontinence and other pelvic floor challenges are essentially core dysfunction, and it's highly likely that your symptoms are a result of a breakdown in either the alignment, the breathing, or the coordination / timing of that inner unit. So this is an image of the pelvic floor. And what I want to point out here is the pelvic floor gets a lot more press. There's a lot more people talking about it, which is fantastic. But people don't necessarily understand what exactly comprises the pelvic floor. So it is a collection of muscles and nerves and tendons, huge blood supply, ligaments, connective tissue, and those are all interwoven into the bony pelvis. So we have bones that make up our pelvis, the bony structure, the bony scaffolding, as I call it. And then the muscles that attach to certain points of the pelvis make up the pelvic floor. And we have 3 layers. 2 layers are predominantly responsible for closing openings. So think pee, poo, and fart. And we also have a 3rd layer that's more responsible for organ support. So bladder, uterus, and rectum. The pelvic floor contains both slow twitch and fast twitch fibers. So slow twitch, think of marathon runners, and fast twitch, think of sprinters. So it's a muscle group like we have in all the other muscle groups in our body. In this picture, you're looking kind of at the back and kind of almost like you're underneath the pelvis. And this is to show the attachment points. So the pelvic floor muscle, the attachment points are from the pubic joint in the front to the tailbone or the coccyx in the back, and then the 2 ischial tuberosities. So if you happen to be sitting down right now, if you take your right hand and you put it underneath your right butt cheek and you kind of pull the flesh away, you should be able to feel a little bit of a bony protuberance there. That's your ischial tuberosity or your sits bones, and you have 1 on either side. So those 4 points, pubic joint, tailbone, and 2 sit bones, form kind of like a diamond shape that forms has the attachment points for our pelvic floor. And our pelvic floor has some really, really important jobs. I look at that as the 5 S's. So stabilize. So the pelvic floor plays a role in our pelvic and spinal control and stability. Support. I talked about how that 3rd layer is really responsible for organ support of the bladder, the uterus, the rectum. Sphincteric support. So we want the assistance with the sphincters to close off the openings when we don't want pee, poo, or fart to come out of us. There's a sexual role. So our pelvic floor plays a direct role in our sexual response, so satisfaction or lack thereof. And then a sump pump effect, which isn't sort of the action through the respiration. I talked about the core 4 with the breathing diaphragm and the pelvic floor, and there's this relationship, almost a dance with every inhale and exhale that has a sump pump action. Incontinence is getting in the way of living your best life, which I talked about earlier. So let's change that. What do your symptoms mean? I want you to grab your bladder diary, and we're going to take a look at what some of the more common symptoms are. I know what it's like to leak. I know what it's like to pee before every workout, because I remember afterwards, before I had retrained my core, I still was participating in that activity. And at the time, because I wasn't educated, I was peeing just in case before every exercise class. I would avoid certain movements. I wouldn't drink water. And these were all issues that were actually contributing or compounding the issue. And I know it can be discouraging, and I know that it can be all encompassing. When our pelvic floor isn't working as optimally as it could, or as optimally as it can really interfere with everything. It becomes one of the only things that we think about. So I'm here to tell you that it can get better, and your desire to live leak-free and confident is possible. So here's what we're going to do for the rest of our time together today. I mentioned grab your bladder diary so you can use it to refer to and to take some notes on when you get some aha moments as I teach you how to show your bladder who's boss. So we have less than an hour left, and I'm going to go through the 6 steps fairly quickly. But again, I want you to take some notes, and these are all things that are really easy to implement so you can eventually eliminate your symptoms. So first thing we want to do is explore what your symptoms mean, because it's something you need to know before you can work on addressing your incontinence. So what are your symptoms? And I'm actually going to post a poll into the chat right now. And this is anonymous, it's not mandatory, but I would love for you to share your feedback here about what is your most bothersome symptom. Is it leaking? Is it maybe leaking with exertion? Do you maybe have strong urges? Is it that you feel like you need to go all the time? So feeling like, you always have to have a bathroom in sight. Is it maybe a combination of all of those? So we can have combination as well. So right now it's looking like we've got a lot of people dealing with leaking. I'm just going to wait for a few more to come in here. So yeah, 40-ish, 45 to 50% of people are dealing with leaking, and that's the most common. And statistically, that would be it is statistically the most common as well. And it's something that, again, is very, very, very common. But again, light bladder leakage is not just part of being a woman. It's not something that we need to accept or to live with and think that it's normal. So I'm going to go ahead now and end that poll. And thanks for all of those of you who did participate. So we're going to take a look now at what contributes to those symptoms: leaking, the urgency, having to go all the time, and potentially a mixture of one, two, or all of them. So understanding what your symptoms mean give you clarity and allow you to implement the other steps with ease. So let's talk about what incontinence is. Any unwanted loss of urine at any time of any amount is considered incontinence. So if you are not sitting on the toilet wanting to pee and urine is coming out of your body, that would be considered incontinence. And there's terms like peasing or sneeze pee or light bladder leakage. There's all sorts of other names that get associated with it, but really at the end of the day, it is urinary incontinence. And it's not restricted to just people in care facilities who are older. Stress urinary incontinence, SUI, sometimes you might see it referred to as, is basically when there's some sort of force or exertion that contributes to a little bit of urine leaking out of the body. So laugh, cough, sneeze, exercise, lifting, jumping, all sorts of things. And it can come down to a lack of synergy between the pelvic floor muscles and the bladder and the management of that intra-abdominal pressure that I was talking about before. So it can be a timing issue, meaning the pelvic floor doesn't contract in time to respond, or it may not contract strongly enough to overcome that pressure. From Dr. Bruce Crawford, he has a program called Pilates. That's not a typo. It essentially is short for pelvic floor Pilates. And he, in his course, talks about the pelvic floor muscles needing to contract 200 milliseconds before that rise in pressure in order to remain continent. And part of the philosophy that I'm going to get to in a minute is all about retraining that anticipatory element so that we can get back to the pelvic floor responding strongly enough and also in time. Urge incontinence, or urge urinary incontinence, is when there is all of a sudden an overwhelming need to empty. And even that can happen even when the bladder is not full. So you could be going along about your day and there may be a trigger or something happens where all of a sudden you feel like, oh my gosh, I have to get to the bathroom right now. And sometimes people can't make it in time, and that can be a complete release of the bladder as opposed to stress urinary incontinence, which is just a little bit of urine that would leak out over the day. Mixed incontinence, or mixed urinary incontinence, MUI, is when you have more than one type. So there are people that have some leaking and they also have frequency, and they also may have some urgency as well. So you can have a mixture. You don't have to always just have one type. And the most common combination is stress urinary incontinence and urge urinary incontinence. There's also overflow incontinence, which is the constant loss of a small quantity of urine. So it's constantly leaking out, not just with exertion, but it's just happening all the time. And this can happen from a multitude of reasons. Also, people that are unable to fully empty their bladder, there can be a residual volume that remains, and that can over time work to distend the bladder and actually can sometimes inhibit some of the bladder sensations and the urgency, those senses of urge that we actually need to have in order to know when to empty. And now I want to look a little bit about some of the contributing factors to incontinence. And there's many, and it could be all of these that are contributing to yours. It could be none of them, but these are some of the more common ones. So pregnancy, birth, this is something that we know from literature, we know from years of stories that pregnancy and birth are certainly contributors to pelvic floor challenges like incontinence. On the image on the left, when we see graphics like this, we can appreciate the shifting, the adaptation, all the changes that happen on the inside of our body. So are there organs getting a little bit compressed, there's less space there, the added weight that's on the pelvic floor, the fact that the belly is growing out in front of us, and oftentimes the breasts become larger, so the center of gravity starts to shift, and we have this weight out in front of us that contributes to us sometimes unconsciously starting to almost tip our pelvis backwards and lean our upper back backwards to counteract or counter, it's like a counterweight almost for that growing weight out in front of us. And when on the picture on the right, when we think about what is then coming out of our body, we need to appreciate the stretch, the pressure to the nerves, to the muscles. There is definitely a disruption to form and to function afterwards. And with the right information, we can really reduce a lot of the negative aspects. And again, from a recovery perspective, when information is shared and people understand what they need to do in their postpartum recovery, a lot of these things don't really manifest into issues. But the challenge right now is there really is a lack of information with regards to the pelvic floor. And, really it's kind of, go home and do your Kegels is one of the only things that we may have heard about. And this is just another image that I like to share that kind of gives you a good visual on, this is a vaginal birth, of course. And on the left side, it would be nothing in the pelvis. And on the right side would be, it's trying to illustrate a baby crowning. And in the image, the face was added. Typically, you don't have a face presentation, but the face was added just to illustrate that it is not just a big, massive hair, that it is actually the baby's head coming through there. But you can see the compression to the bladder, and it helps give you an appreciation for the size, the expansion that happens, and how that could then influence the muscles, the nerves, the ligaments, everything within the pelvis as well. Posture and alignment is a big one. So posture is, alignment is actually the byproduct of posture. So how we hold ourselves would be our posture, and then the resulting adaptations contribute to the alignment. The image on the left is becoming more and more common, and this isn't just people, it isn't women, it's children, it's men, it's everybody. With the amount of sitting we do, with the amount of forward-facing activity that we do, especially in front of computers and with phones, we have this forward head, rounded upper back, and the pelvis is thrust forward. That's something that I see very commonly in pregnant people, again, because we've adapted to try to counteract that shifting center of gravity by actually pushing our pelvis forward and leaning our upper back behind us. And ideally, we want to hold ourselves and move in ways throughout the day that contributes to a nice stacked alignment where we have our ears over our shoulders, over the, through the pelvis, the knees, and the ankles in a nice straight plumb line. That allows for optimal alignment, breathing, and coordination, as I was talking about earlier, the ABC. So it allows that sump pump relationship between the diaphragm and the pelvic floor to happen without us even having to think about it. When we have the posture on the left, that alignment is off. And over time, there's some muscles that shorten, some muscles that lengthen, and it interferes with that core 4 synergy and function that we need for optimal pelvic floor. The other piece is aging. So as we age, we lose muscle mass, we have a decline in collagen production, and especially with regards to the pelvic floor, we have to look at the hormone piece. And as we approach menopause, which is the average age around age 51, but perimenopause, before then, we can be having a lot of different hormonal fluctuations that can also influence the pelvic floor. And sometimes we may have some kind of little naggy symptoms along the way, but we as women, I don't know if we're all women on the call here, but generally as women, we are prioritizing many other things, our spouses, our children, our work, all the other things on our to-do list, and we don't prioritize ourselves. And so some of these naggy little symptoms can be potentially, making little suggestions along the way. And it's not until we reach menopause or start to approach menopause where they start to become a little bit louder. And it's to do with the decline in our estrogen. So we need to keep in mind all the different factors of aging, with hormones being one of them. We can also consider the weight. So as I mentioned, when we're pregnant, there's an additional weight on the pelvic floor. So there's more load for the pelvic floor to manage under a shifting center of gravity. But even when we're not pregnant, if we are carrying excess weight on our body, that also can influence our pelvic floor. And sometimes that could also contribute to things where we may not be moving quite as much. So maybe our weight is getting in the way of that. And maybe some people avoid fitness and movement for fear of leaking or making it worse. So then they end up gaining a little bit of weight. So it kind of becomes a bit of a chicken and an egg situation as well. Low back pain. So this is something that many people suffer with low back pain. Again, not just women. And there was a Canadian research, Dr. Sinead Dufour, who looked at low back pain and did a study, and her study showed that 93% of women with low back pain have some degree of pelvic floor dysfunction. So that's super high. That's crazy how many people are dealing with low back pain. And usually when we have back pain, we go to the dentist. Sorry, we don't go to the dentist. We go to the chiropractor. We go to the massage therapist. We may go to a physiotherapist, but we aren't seeing pelvic floor physio, which that's one of my steps. I'm giving you a little bit of a sneak peek there. But low back pain is really, really commonly associated with pelvic floor dysfunction. So if that is something that you experience, then next care provider you're looking to see, check out a pelvic floor physiotherapist, and I'll talk about that in a little bit more detail. High intensity exercise can be a contributor. So leaking when you exercise is not normal. Leaking when you lift is not normal. And one study showed that more than 80% of CrossFit participants reported urinary incontinence, and half of those reported moderate to severe urinary incontinence as compared with women who participated in non-CrossFit classes. And this isn't to bash CrossFit, this just happened to be what was in the study. And the exercises that were most associated with the urinary incontinence were jumping and weightlifting. So talking about weightlifting, there's also some evidence that heavy lifting and fitness can be a contributor to incontinence. Approximately 41% of women powerlifters had experienced urinary incontinence at some stage in their life, and 37% of women powerlifters currently experience urinary incontinence during training, competition, and maximum effort lifts. So this isn't to say that we shouldn't lift weight, but we need to be mindful of the amount that we are lifting, and is it serving us? I believe that people with female anatomy are fundamentally and physiologically different than those with male anatomy. So while there is a drive to be the same and participate in classes with men as well, we really need to consider that we have differences biomechanically, physiologically. We go through a menstrual cycle. Many of us have been pregnant at some point in our life and have given birth. So those are all things that always need to be considered. Dr. Stacey Sims says that women are not small men, and I couldn't agree more. So perhaps we need to create more awareness around honoring the biomechanical changes and differences, the physiological differences, and also the fact that we do experience a menstrual cycle. Surgery can also be a contributor. So people say, well, surgery should be a solution, really, in a sense. And surgery is sometimes pursued or offered as a solution to people with incontinence or other pelvic floor challenges. And surgery eliminates the symptom, but it doesn't necessarily address or fix what contributed to the issue starting in the first place. So another missing element, just like we don't have a lot of information with regards to birth prep and recovery, we also don't have any information shared with regards to pre-op, prehab before surgery, rehab after surgery, and then a gradual progression back to fitness. Scar tissue that remains after surgery can impede muscle function. And so if that's not known about or addressed, that could potentially contribute to the development of other issues, or it might mean that the issue comes back. And some people who have surgery, it can be liberating because it has removed the symptom that was maybe preventing them from doing other things. But sometimes our symptoms are teachers. And when the symptom isn't there anymore to tell us to slow down or to tell us to do something differently, then we may go harder, or we may go back to doing what we were doing before. But if we don't have the right strategies and awareness with that alignment to be considered, the breathing to be considered, and the coordination to be considered, then we can potentially end up in the exact same place as we were before we actually had surgery. So this is just a quick little funny to drop in here. Hope you guys are all still with me. And so incontinence is not life-threatening, but it is life-altering. And I want to share with you a couple of stats now. So 28% of nulliparous, so people who have not been pregnant, elite athletes have, sorry, I have a typo there, have urinary incontinence. And that was from a study in 1994. So it's a bit outdated, but these have rung true through lots of other more current as well. Trampolinists, 85%, gymnasts, 67%, tennis players, 50%. So again, these are not old trampolinists. These are young athletes who are experiencing challenges. Incontinence increases with age. So this is another study. 16% of women aged 18 to 40 experience incontinence, 32% of women 51 to 64, and 55% of women 65 or older. And the thing is, these are studies and reported cases. And I think that there are actually a lot of other people. I think these stats and numbers are actually higher because not everybody seeks help and reports their issue. Up to 70% of women will experience urinary incontinence during or after pregnancy, and that was from a Stride poster. And in the last trimester of pregnancy, 48% of primiparous, so people who have had one child, and 85% of multiparous, so people who've had more than one child, will have urinary incontinence. Following vaginal childbirth, this is from Dr. Bruce Crawford, the creator of the Pilates program as well. The risk of stress urinary incontinence is 23%. Urge incontinence, 12%, and any urinary incontinence is 29%. And it was 34% for new moms who were over the age of 30. If somebody had urinary incontinence at 12 weeks postpartum, 92% of those people will still have it at 5 years post. And there's also studies that are now looking at if you're experiencing urinary incontinence during pregnancy, and if you can address it while you're still pregnant, you can actually eliminate it, and then you're less likely to be experiencing it on an ongoing basis. But that is something that is, again, people take for granted. Oh, it's just because you're pregnant and you're leaking because there's less space, and we don't necessarily appreciate that is something that it's still a signal the body is sending, and we can intervene and offer some help. 5 to 7 years postpartum, 44.6% have some urinary incontinence, and 25% of primiparous women have fecal incontinence. So I'm talking mainly about urinary incontinence on this webinar, but we can also have fecal or anal incontinence where we leak gas or stool, which can be tremendously life-altering. So now let's talk about our 6 steps here. What can we do? That's what we're all here for, right? Step 1, I've referenced it already, pelvic floor physiotherapy. I say this ad nauseum. When I look back to when I was reaching out to the pelvic floor physios who were referring people to me for the Epino, after my first meetings, I left there thinking, how in the world is it that not every single person who has given birth is seeing a pelvic floor physio? And how is it that our government is not paying for it? I know in France, women typically have 6 to 12 visits paid for by the government, every single person who is pregnant. And I think that that should be something that we are globally responsible for, really. So pelvic floor physiotherapy is always my #1 line of defense. It's the first thing that I recommend to absolutely everybody. And it includes an internal assessment to measure tone and strength and coordination and timing. And you can find a video on my YouTube channel where I walk through the steps of what exactly happens in a pelvic floor physiotherapy assessment. So again, it is an internal assessment. So they use gloved fingers to evaluate the external genitalia and also the internal aspect. So they're looking at observing the balance of tone between both sides. They want to see if there's any scar tissue. They evaluate the position of the organs. They can evaluate your ability to contract and relax, so to do a Kegel exercise. And when you seek treatment from a qualified physiotherapist, so people who are licensed and trained to treat beyond the introitus, which is the entrance to the vagina, it's 80% effective at curing, improving at least, but curing incontinence. So it is significant. And if that is a step that you have not pursued, I highly, highly, highly recommend. If there's one thing you take away from this call, this webinar, is see a pelvic floor physiotherapist. And I'll show you a resource of how to find one in just a moment. So when you see a pelvic floor physiotherapist, they are doing the assessment, and then they often have elements of treatment as well. So pelvic floor muscle release is one aspect, and it's not all about strengthening and doing Kegel exercises till we're blue in the face. Sometimes we actually need more relaxation in the pelvic floor. Sometimes we need to release trigger points. Just like we have trigger points in the rest of our body, we can have trigger points in our pelvis. We can do some myofascial release. So again, that's something that's very common now with massage therapy, and in fitness, we can do the same thing in our pelvic floor. Scar tissue mobilization. So I mentioned that post-surgery, and surgery again is also cesarean, but also an episiotomy, or if somebody has tearing from birth, or maybe it's been from another type of accident or another type of surgery. Any scar tissue within the pelvis can inhibit or interfere or hinder our function, and pelvic floor physiotherapists can help release and mobilize that tissue to ensure that the muscles can function in a balanced way. And they also work at helping us down-regulate the central nervous system, because sometimes the emotion that can be tied with pelvic floor dysfunction can upregulate us and keep us in sort of a fearful state. And when we can down-regulate, that helps not only our feelings of confidence and down-regulating the anxiety, but can also help from a muscle function perspective as well. When we initiate pelvic floor muscle training in the immediate postpartum period, it may also reduce the risk of future incontinence. So that's one more study. And then on the right-hand side is an image of pelvicgurucom. And there's a few different sites that you can go to find a pelvic floor physio. This is a pelvic floor physio in Florida. She calls herself the pelvic guru. Her name's Tracy Scher. She's fantastic. And she has a directory on her site that is now it's becoming one of the bigger ones. It's global, and it's not just reserved for pelvic floor physios, so pelvic health professionals, but it is highly geared to pelvic floor physio. So that's one place you can go to find somebody. You can also Google your city or town and pelvic floor, or pelvic floor physiotherapy, or physical therapy. You can also go to the American Physical Therapy Association and look under women's health. If you're in Canada, you can go to the Canadian Physiotherapy Association. And also in Canada, there's another site called pelvichealthsolutions.ca. I used to have, I think it was actually one of the first directories in Canada on my site. And it, with the growth, which was fantastic, I just couldn't keep up with it so much. So I ended up closing mine down because there was other more robust directories out there that I can direct people to. So highly, highly recommend. Even do it now if you want. I'll let you go off the call for a minute and go find a pelvic floor physio and make an appointment. Step number 2, we have to learn how to Kegel correctly. So I talked about that a little bit earlier. When we see a pelvic floor physio, that is something that they can help us with. If we don't have access to a pelvic floor physio, then we can use our own fingers. We can use, again, a partner's fingers. If we have a male partner, it could be a penis. There are also biofeedback devices. The one that I use, the Epino, there's some that are kind of like the Epino 2.0 that are a little more interactive and actually have apps on your phone. There's one called the Elvie, ELVIE. And this is the one that I recommend for people who don't have access to a physio, because it has a biofeedback component that actually can distinguish between a proper pelvic floor contraction, where there's a contraction, a drawing up, versus people who bear down thinking they're doing a Kegel. So it can be a good teacher or a good starting place. The other one that I recommend is called the PeriFit. And those have interactive, almost like games that are on your phone that allow you to interact a little bit with your pelvic floor, because it's part of the body we don't see. And it's nice sometimes to have a little bit of feedback to see what's actually happening. So this is taken from, I have a video on my YouTube channel called The Core Breath, and you can go and find that. And again, practice that. And then when you go see your pelvic floor physio, take what you learn from that video and take the cues that I use in that video and try them out with your physio. And maybe you'll come up with another cue that's actually better for you, or maybe your physio has a cue that's better for you. But it's a really good education piece to help you finally understand what it means to do a Kegel. It's so often prescribed, but it's very rarely taught, and so many people are doing them incorrectly. So that's step number 2. Step number 3, I've alluded to it before, we have to mind our posture. So I also have a couple of videos on my YouTube channel where I walk you through how to sit in a neutral pelvis, how to stand in a neutral pelvis, how we hold our pelvis through the day, and where we spend the majority of our time will directly influence our pelvic floor. We, in this, a lot of people are spending more time at home right now. We are often sitting in front of a computer a lot more maybe than we used to be. And oftentimes we're sitting with a posterior tilt. We're sitting with our sacrum and our tailbone tucked underneath us. And that can contribute to SI joint pain. So pain in the tailbone, pain in the SI joints, low back pain, pain in the pelvis. It's definitely a position that is not serving us. And it also, again, takes us out of that optimal alignment between the diaphragm and the pelvic floor. So that sump pump, that respiration that we need with every inhale and exhale doesn't happen as freely. It doesn't mean that we can't breathe. We, of course, oxygen's coming in, but the relationship between the diaphragm and the pelvic floor is not optimal. So that we start to develop a little bit of degradation there. And some of those that the core force energy I talked about earlier is not as accessible. So how you hold your pelvis matters. And yeah, I invite you to check out the videos on the YouTube channel to get your posture in check. Step number 4, we need to Kegel coordinated with movement. So my 3C approach is we need to do Kegels correctly. We need to do them coordinated with movement. And I'm going to save the third C for one more slide, just hang tight. But we are dynamic beings, and Kegels are something that typically people think of as do them at every red light or do them while you're brushing your teeth. And that's better than nothing. And if you have been taught how to do a Kegel correctly, then at least you're doing more than nothing. Like, it's better than doing nothing. However, incontinence symptoms, leaking, what have you, those typically aren't happening while we're sitting at a red light or while we're brushing our teeth. It usually happens when we are exercising or when we are lifting up a bag of groceries or when we're pushing a heavy door open, what have you. We have movement that is somewhat the stimulus that makes us leak or potentially contributes to some of our symptoms. And so we need to train the pelvic floor to respond in movement. So once we understand how to Kegel correctly, we then start to do some exercises, some movements where we add that inhalation and exhalation and voluntary pelvic floor activation just before we move. So for instance, the top image where I'm doing a push-up on the ball, I would exhale and engage my pelvic floor just before I push myself back up into a straight arm position. And then I would inhale and I would let my pelvic floor, I will say, blossom your vulva, let your pelvic floor relax and release as you lower down. Exhale, engage your pelvic floor, and then push back up in the push-up. In the bottom picture where I'm doing the bird dog, if I had both arms and legs on the floor, that would be where I would be inhaling, and then I would exhale and I would engage my pelvic floor, and then I would lift my left arm and my right leg. And then I would bring my arm and leg down as I'm inhaling and releasing my pelvic floor. So you kind of get the idea where we start to coordinate the breath with movement and that activation of the pelvic floor. And that's how we retrain that anticipatory element. So I was talking about way back at the beginning where we were talking about there's the pelvic floor and core, there's an anticipatory element where it should be doing its jobs and we shouldn't have to tell it what to do. But over time, from all of those various influences that we were talking about earlier, sometimes that anticipatory element can go away and we need to find it again. We need to retrain it. So that's what our step 4 is. We want to coordinate it with movement. And just one more point on that. I don't mean movement like running or when we're out for a walk. Just allow your pelvic floor to respond as it needs to during cardio-based activities. These are more purposeful kind of body weight or weight training activities that I'm referencing. Step number 5, bladder retraining. So this is again where your bladder diary will be helpful. Normal voiding is every 2.5 to 4 hours. So anywhere between roughly 5 to 9 times in a day. And ideally, we're not waking up at night to go pee. So that's what would be considered quote unquote normal. And there are things that can contribute to us going more often. So if we have a huge volume of liquid, that could increase the need to go. If we were eating or drinking something that was considered a bladder irritant, or maybe even not everybody considers it a bladder irritant, but maybe it is for you, then that might contribute to the bladder signaling more often. If we are avoiding drinking water, so if we think, oh, well, if I don't drink water, then I won't have to go, that actually concentrates the urine and it makes it more irritating to the bladder. So the bladder wants to get rid of it, so therefore it's going to signal you more often. So we want to drink throughout the day, water throughout the day and drink consistently. I always recommend aiming for at least 2 liters of water every day. So use your diary to track what you're drinking, how much volume is coming out of you, and then you'll start to notice some trends. And if you get a signal to void that is sooner than 2.5 hours, then you kind of say, okay, have I had a huge volume? Did I drink, 500 mils to a liter of water? Or did I eat something that was maybe irritating that wants to come out? And if those answers are no, then you say, okay, there should be no reason why my bladder is signaling me. So you're going to talk to your bladder. And this might sound a little woo-woo or a little bit weird, but you're going to walk to the bathroom and you're going to be talking to your bladder saying, I know that you're signaling me to void, but we just went an hour ago and I haven't had a huge volume of liquid and I haven't had anything that's irritating you. And I know that I have played a role in contributing to you signaling more often, but I'm going to take back control here and recognize that you don't need to empty right now. And you might still feel a little bit of sensation, and that's okay. And you don't need to say this out loud. You could say it in your head. And you're going to stand in front of the toilet. And a distraction method also is to do some calf raises. So while you're talking to your bladder, you can also do some calf raises, and that can sometimes interfere with that signal to the bladder that really only lasts about 30 seconds or so, maybe even a little bit less than that. So once that signal starts to subside, then you're going to walk away. Another distraction technique is doing Kegel exercises, actually, so contracting the pelvic floor. And sometimes that can be something that people are doing already because they don't want to leak, but maybe they're actually squeezing their inner thighs or squeezing their glutes instead of their pelvic floor. But when you can take back control like that and you walk away and the signal has subsided and you don't respond to that urge that wasn't necessarily welcomed right now, that is so essential. That is so key. And that's where you start to take back your power. So use your bladder diary, talk to your bladder, use your distraction mechanisms, but also make sure you stay hydrated throughout the day. So we're now on to our final step, step number 6. And this is the third C in my 3C approach. And that is that we need to Kegel consistently. Consistency, and this isn't just with Kegels, this is with everything. If there's something that we want to change, if there's a new habit we want to adopt, we have to pay attention and be consistent with our effort. Kegel exercises are not a quick fix. There's something that we need to do correctly. We need to add them into movement, and then it becomes part of our life. It's a Kegel lifestyle. It's not something that we do till our symptoms go away and then we just, go back to doing whatever we were, because the symptoms are going to come back again. So always pay attention to incorporating some form of pelvic floor activity each day. So what do you risk by not taking action? We've looked at some of the more common symptoms, what they mean, what the contributors to incontinence are, the stats. We've looked at the 6 steps that you can implement to start making change. So now are you going to take action? And some people might be telling themselves, well, I'm too old, or it's too late for me, or maybe you're saying I've tried Kegels and they don't work. There's all sorts of excuses that we can tell ourselves, but does that mean that you're going to accept that you just have to live with your incontinence? I really, really hope that's not true. I want you to know that light bladder leakage is not just part of being a woman, despite what media tells you, despite what you may have heard from other people or even other healthcare providers. It's simply not true. So in terms of what the risks are, we risk isolation and decreased socialization. As I mentioned earlier, incontinence is not life-threatening, but it's definitely life-altering. And if it's left untreated, it can contribute to things like isolation and depression. And I want to start another poll here again into the chat. And this one is going to address, sorry, here we go. I'm going to start this poll. So how many of you have avoided certain events or outings because of your bladder? How many people have had this interfere with their life? So I'm just going to wait for a few answers here. So we're kind of like about 60% say not yet, 40-ish% saying yes. Yeah, so it's kind of juggling back and forth between 60% saying not yet, 40% saying yes. So I'm going to go ahead and end that poll. Thank you for all of you who participated in that. So risking isolation and decreased socialization. If we're afraid that we don't have a bathroom nearby, if we're afraid we're going to leak, if we're afraid that we're smelling, if maybe if we're dating, we don't want people to think that we smell, or we're afraid of our partners seeing something or smelling something. We're going to avoid situations, and that's not good for our mental health either. We have the risk to our intimate relationships. So some of us who are in partnerships, if we start to worry about incontinence, again, do they smell? Can they feel it? Am I leaking urine during sex? We're not present in the moment, and we may start to avoid sexual encounters. And then if there's because it's kind of taboo, because it's embarrassing, we may not be talking about it with our partners. And then the partner's wondering, what's happening? And do they not love me anymore? And so that it can contribute really to a breakdown in the relationship. And I often say that pelvic floor physiotherapy, I think, can save relationships, can save marriages. So we need to consider the risks associated with not taking action. There's also the risk of nursing home admittance. So this was from a study that was 2003. Incontinence was second only to dementia as the leading cause for admission into assisted living. So people who are caring for elder parents, we can put up with a lot, but when it comes down to if our loved one is now no longer able to maintain their continence, that is a point where a lot of people just say, I can't do this anymore, and will pursue care facilities. So I know I don't want to be in the situation where I need to go into a care home. I don't want to be in depends. I want to be enjoying a vigorous, happy, movement-filled, movement-rich life for as long as I possibly can. So I take action. We also have the risk of lack of exercise. If we are afraid of leaking or afraid we don't have a bathroom close by, then we may just, we may avoid exercise, or maybe we're afraid of making our incontinence worse, so we stop moving. And that puts us at risk of other challenges with our health as well. We have to look also at the risk, the economic burden. I always call it pad math. So if you think about what you're currently spending per month on pads, I did a little bit of math and looked at the very basic panty liner. If you were using one a day, it would be about $30 a month. If you're using more than that, or if you're using heavier, more robust pads, it can go upwards of $100 a month. And then if we think about when we start that in our life, a lot of people are starting that in their 30s, early 30s. And if we think about how long our lifespan is, I went out, 50, 60 years, it can be between $18,000 and $72,000. That is significant. What would you do with an extra $18,000 to $72,000 in your pocket? And we also need to look at the environment. So the pads we are using on a daily basis are ending up in our landfill. So we think about how much more money we could have in our pocket, and we can think about how much more robust our earth could be if we didn't have so much going into the landfill as well. So to recap those 6 essential steps, pelvic floor physiotherapy, again, if there's one thing that you do, find and make an appointment with a pelvic floor physiotherapist. Learn how to Kegel correctly, mind your posture, Kegel coordinated with movement, retrain your bladder, and then you have to Kegel consistently. So it's a matter of taking action, and I hope you can see how easy it is to implement the 6 steps once you know what to do. And I want you to know that change can happen very, very quickly. For me, it was under a month. And that was pretty consistent with the people who I've worked with in the past and who have taken my programs. Usually around 2 weeks, people are noticing significant change. I've incorporated these 6 steps into a program that will help you implement everything that you learned and fast track you to taking back control of your bladder so you can ditch the pad. So it's time for you to take action. And I want you to invite you to take my BuffMuff challenge. It's a 28-day program that over 2,500 women have participated in, and when polled, 100% said they would recommend it to a friend. And they recommend it because it works. So included in that, it's an app-based program for iPhone and Android. You get daily reminders. You have a daily pelvic floor BuffMuff workout. It starts out around 7 minutes or so, works up to about 10 to 12 minutes a day. You earn points for completing each task. There's bonus content that unlocks at certain point levels. You have a chat function where you can ask me anything, and you can connect with others as well. So week 1, we start out where you will learn how to do the Kegel. You'll learn how to do the core breath, and you'll learn about the posture and alignment that I was talking about earlier. You will have 7 workouts. about 5 to 7 minutes in that first week. You're going to earn your points. You have your chat function to ask and share. And on the right-hand side, you can see an example of what the chat looks like. And this person was saying they were glad they signed up. They haven't had any accidents since, and I'm more aware of my pelvic floor and posture and tight hips. So a lot of people talk about their tight hips when they're going through the challenge. Week 2, we start to progress. So the intensity is about 6 to 8 minutes in terms of time. Again, you have 7 workouts, 1 each day, and you will get to your first bonus that unlocks at the end there. And this was a comment that I loved. This person actually ditched the pads only halfway through, so in 2 weeks only. So it can happen again very, very quickly. Week 3, it starts to get a little bit harder. It's about 8 to 10 minutes, and there's more results that are coming in, and there's more bonuses. And this gives you a snippet of kind of what a day would look like. So we had a lower psoas release, standing bird dog, the lunge, the Frankenstein walk, and the supine butterfly. I always start with release work, so releasing non-optimal strategies. Then we work on the activation, and then we end again with some release work. Pelvic floor muscle training is a balance between effort and ease. So we have some work and we have some release. And sometimes the release is what we need a little bit more of. And it's not all about activation. Week 4 is ideally everybody becoming symptom-free. They're starting to feel much stronger. 10 to 12 minutes is about your time frame. You'll go through your final bonuses and ditch the pads like Heather Christensen did. Included in there is also, again, that community chat and forum, and again, a sample on the right of people who are using the chat. So people commenting on, this exercise was really challenging for me today, or I noticed that this one, if I did this, this helped me. I can also chime in and share other alternatives and images for people who are looking to, for alternatives if something's not working for them. And now we're going to move on to the bonuses. So you'll also, as part of the challenge, you get access to my book called The Inside Story and my favorite meal plan called Smooth Moves, which is high fiber. Constipation is such a challenge for our pelvic floor, and we really need to make sure that we have our digestion optimized and that we are pooping freely and without straining every single day. So that's a really valuable bonus that you get there. And I'm going to put into the chat the sign up for the BuffMuff challenge. And the first 15 people who sign up will get a free 30-minute private coaching call with me. So that's a $75 value. I know that everybody has a story and they have unique needs, and a private call can help tailor the program to your specific situation. So anybody who's taking action the first 15 people will get a free 30-minute call with me. And we are going to wrap up here. So I invite you again to take some action. Don't sit there and accept it as normal. It really is something that it interferes with our quality of life so much. And when we can address it, our life becomes richer and fuller, and we can truly participate and be fully present with everything. So the link is in the chat. You can go ahead and take advantage of that. I really, again, urge you to take, no pun intended, I urge you to take action. And I'm just sharing a few more testimonials from people who have gone through the challenge and have shared their wins. Halfway there, catching up, feel like I've learned a lot and how to do the Kegel through this program. And I'm starting to see a difference in the way my pelvic floor is responding. My alignment and strength have improved. My sneeze pees are less frequent, and my favorite exercise is the thoracic release. I'm behind because I have a newborn who wants to be held nonstop with a toddler. I'm only on day 4, but just had a coughing fit, and for the first time in 3 years did not have pee come out of me. So again, change can happen very, very quickly, especially when we pay attention to our alignment and our breathing and the coordination. So a few more comments here, and this is one of my favorites in the middle. A month ago, I committed to myself by reconnecting with my pelvic floor physio, Joanne, and joining this program. What I'm experiencing are things I had never thought possible. My belly is lifted, tension in my neck and shoulders is decreased by half, and the oxygen I breathe is coming in at 100%. I always felt I could never get enough in. When I saw Joanne yesterday, she squealed with enthusiasm at the progress I have made. This lady's is gold. Thank you, Kim, for your dedication and knowledge. So I love that. And she ended up, was getting married shortly after. And then she shared another comment later on where she talked about how it had improved her sex life as well. So change can happen in many areas and aspects of your life. So I invite you to take action. You deserve to live leak-free and be the boss of your bladder.